So when you're pulsing and you're talking about your control over your urinary sphincter, the sphincter is a muscle.
Okay, yeah, it's like my bladder. Okay,
yeah.
Oh, but the sphincter is
a muscle. It's gonna. You can contract that, and Hey, am I letting go or am I pinching off?
That's a good way. I don't want to laugh on this, but
yeah. So if you can better control that from brain down to that spot, given that you have lived with MS,
right?
That means that the pulse magnetic field therapy, as it's been going through you, has also conditioned neurologically or to the deepest cellular level, neurologically, muscularly, and functionally. The connection between the two points,
right?
Your ability is giving you this new ability because you
True.
Now, this is not something that is like mainstream advertised. Like, I'm not going to throw an advertisement up and say, if you want to control your sphincters,
Agreed.
Pooper or peer or whatever, whatever else. There's there's some other ones, other muscles, pelvic flourish, whatever, Kegels and whatnot.
True.
Now, again, pulse on Kegels, pulse on that stuff, pulse on prostate health, pulse on erectile dysfunction, pulse on incontinence, pulse on all the stuff. There's research that supports that.
Right.
But the advertisements can't be vulgar.
Understood.
About, hey,
but how I take it? I take it as that added benefit. Like, I came here for walking and standing and strength.
Right.
But to find out, like, oh, I can hold that a little bit better because, as you know, and I'm sure most people, if you have an autoimmune disease, you cannot control it. It's not really even.
It's just going to come when it comes. Yeah. It's going to come when it comes.
And it's not even a mental thing because if you make it mental, then you're going to get in your feelings.
Yeah.
But to get that side benefit from,
doing all the other therapy,
like, let me hold that.
There we go. So now you have this new. So that is a quality of life factor. And I've had so many people.
That's a good way to put it.
Now, this is a true statement. So people who are watching, who will watch this, if you attack me, I'm going to eat your ass. But I'm going to tell you this is a true statement. I will chew your butt if you try to attack me on this one.
Good luck with that.
Yeah. Clients that I've worked with in the past 14 years that are living with most forms of paralysis, that are wheelchair bound, have easily said, if I could have my bowel and bladder back, this wouldn't be so damn bad.
Right.
Now, it's bad enough.
Independent as an adult that you can control your bodily function.
This would be bad. It's bad enough. It's really bad enough.
Agreed.
But if I had those two, and not wake up in it, not have to deal with it, it can be intimate and not worry about it, then I will be good.
Right.
Okay, well, so I say to you, we got pulse electromagnetic field therapy. That's the only theoretical, experimental, custom thing that can be used to address it, but people don't, it's not mainstream. People don't beat that drum.
Right.
And now that I know it from research, having read the research, they're not hearing me on it.
Well, let me tell you, let me tell you as someone who hear me. But let me tell you how this is interesting, and it's the reverse of what happened when I was first diagnosed. They tried to deal with the tightness in my right leg, so they gave me baclofen, which is a muscle relaxant. Unfortunately, my leg was too tight for it to be relaxed by that. But you know what it did? It relaxed my bladder. So I didn't want. Because as you understand, it's not targeted. It's like, we're going to relax something.
Right.
It was already weak. You relaxed a weaker muscle, and I had to stop taking it. Still can't walk, and now I'm having accidents. I'm having issues that I didn't have before.
Right.
So it's nice to use this and have the reverse happen, where I wasn't looking to have that improvement or that strength or that control. And that's low-key what I'm getting from coming here on a regular basis. So,
like we said, the pulse going through helping the cells. That's what it's facilitating cellular stuff. But it's making the muscle contract.
True.
So if a muscle contracts, it gets tone.
Okay.
And a tone in the muscle. So first, when if we say a fitness model, or we say a person standing over there posing, they have tone. Muscular tone means we can see their muscles because they've cut the fat away and the muscle's hardening. The muscle's tighter. But in paralysis, we say tone. First, we got to say, is it neurologic tone? That bad, constant contraction that we don't want that stroke survivors deal with, that stiffness that sets in? Or is it the tone of the tissue in the sense that the loose, flaccid, unresponsive muscle has now become tightened and more elastic? So we have a case where using a different method, using a bioelectric insertable probe.
Okay.
Literally made a person's outie become an innie. The sphincters prolapse. They come out because they relax.
I'm trying to be mature as well.
I know. But again, people, it's a taboo topic.
It is. It needs to be discussed.
It needs to be discussed in some form. So the outie that became as a result of the paralysis has now become an innie because the tone of the muscle happened.
And it allowed them to get back.
So now they can feel a pressure there, or they can feel something.
Right.
Now, when they feel something's there, I mean, hey, it's right there, knocking at the door. We're police, we're coming in. That means in that case, it's coming out. Get your ass moving. You better start moving because that's what's happening. So I have access to those types of things. I don't advertise it clearly. And you can't say, hey, dude, you're going to stick this thing in your wok, and then we're going to turn up this stem and do this with it. And yeah, I got ear clips. You know what I thought about with those ear clips? I can grab some scrotum sac tissue and and turn that device up.
And we don't know if that was the pulse or what she heard.
And then and turn up the current because there's a frequency for estrogen production. There's a current of frequency for testosterone production.
So basically, you know what the best way to put that in is, I guess that would be like not reproductive health,
but it is. It literally is
so
reproductive system health.
Should be if we put it in that
context.
Correct.
Yeah.
Correct.
So if we say reproductive system health,
correct,
which insinuates all of the thereby associated organ systems, men and female.
Agreed.
Then we are addressing those issues. And when you get into the details, it's very serious issues. And I say when you're married, your husband, your wife, your spouse is involved. Your partner is involved. Okay. And if you're single, then you can have same-sex involvement, or you can have, all necessary precautions are going to be made.
Basically.
Yeah. Someone you can trust is going to be there with sense about them to do what's right in that situation. And I've addressed those in other situations thus far. I've gotten this whole doctor thing that people think, oh, Tony's smart. He's doing a lot of education. He's kind of like a doctor, just not one yet. Will be kind of, sort of. But I can trust him with this issue. So I literally had someone send me a picture. Hey, I got this issue going on. Hey, why are you telling me? You better talk to your damn medical doctor. I'm not sure. What are you telling me for? I ain't going to do it with that. So on several occasions. So
you said on more than one.
Yeah. So given that,
it's
like,
nice that people respect you so much and they trust you and they know that this is.
Yeah. So that's the 10-minute default on that. So carefully. There you go.
Correct.
So then we say, okay, based on what I know and what my capabilities are, here are the devices or utilities I know of
that could be beneficial.
So look this up online, find this, get this. When you get it, let me know. I can talk you and your spouse through how to use it. And that's what it was. It wasn't even an issue. Like, so now it really was a very mature adult medical conversation, client-patient confidentiality that our client doctor kind of talk where this is what I know about this. This is what I researched about this. This is what we can probably do with the things that I have in my arsenal. And this is then what kind of things you could expect if you repeat this on your own by owning the devices and me helping instruct you initially how to do it. But then I'm hands off after so many applications.
No, but that's really fair in the fact that someone can actually work towards their recovery in the privacy of their home with someone they trust. That goes a long way towards the whole healing mentality. Right.
So that's basically what, that all kind of comes down to. So as little as, which is taught in our training with pulse centers. Correct. That pad, the square pad, the smaller one you're sitting on, is what pulses the lower region. Correct. The nether region.
I'm so mad. I was like,
the dark zone. We're gonna call that the dark zone because it's the dark zone. And the side that sees no light, and it gets so it gets up in there. So there's another company, some colleagues of mine, non-invasively. There's some colleagues of mine that have a device that invasively they can push 9-11 inches of energy up through that sacral to that bundle, the nerve bundle. But it's pretty invasive. Yeah. You got to be legs up and somebody's holding a probe up in there and you're getting pulsed and So now you sit here fully clothed.
Correct.
get the magnetic field therapy pushed through you, and it's doing its job. And this is a question of how many sessions you need of that targeted therapy to do what you need to do. And there's no embarrassment about anything.
Exactly.
You know, so.
No, that's good. Actually, is there a reproductive health month? You know, like breast cancer is.
Well, there's breast cancer. I don't know about.
But is there anything for reproductive? Because we might have to make something up.
We got to, I mean, dudes. Okay, so we know from what I understand, erectile dysfunction is a multi-million-dollar industry. Might be. Wow. I can't say billion. Actually, I don't know for a fact. I wouldn't be surprised if it's a billion-dollar industry. Right. But if you say 1 in 3 men or 1 in 4 men deal with it, especially over 35, now they don't feel comfortable talking to their doc. Right. And if we with your boys, you don't feel good. Hey, I'm gonna go. Hey, you ain't gonna come on. Hey, man, my thing ain't working right. What you doing? You know, and that ain't finna happen. Like, so yeah, I was just dealing with it. You know. Right. And then there's some people who might be a little bit more open, but you find those far and few between. So, so especially with women, you know, hormonal imbalances. We just say that in general because that's men and women. True. Hormonal imbalances will lead to this because what happens when they say, oh, by the time you turn 35, what happens in life by the time we turn 35? You got a job, you're peaked out in that job, you're stressed the hell out by the job, you're trying to make money, you're deprived of sleep, you're doing other things, you got a lot of toxin buildup in your body, you're not flushed out. So it's just a series of events that you happen from 20s into your 30s that then lead to that, because that's what it comes down to. When we look at the health field, by the time we're 40, we got a certain set of things happening because it's been the buildup from 20 till then, or up till 40.
We're not releasing it. We're not
you're not getting rid of it. You're not doing. So now it starts to show. That's why people over 40 always got something going on. It's not a person I know that's over age 40 don't have something. Why? Because we spent the last 40 years beating the hell out of our bodies. So now here's the downside. So now the medical profession steps in. Hey, this is what we have for it. Boom. You know, this is what we've researched. Boom. So okay, well, here's how we address it. So what do we do? So same thing. So reproductive health is a total, men and women, $1 billion industry. And there's supplements out there. Some are natural, some don't work, some do work. Some people will admit which ones they've tried and which ones that work best for them, others won't. Hormone replacement therapy is out there. Not anybody want to be injecting hormones.
You make me realize how much fertility is an issue for men and women. And you basically just explained it between the stress and the fact of, you know, if we've had things that are lost and we're not stimulating it, we're not allowing it to grow, we're not allowing it to heal. So it's a lot of implications in this conversation about reproductive health, not just about bladder control, not even just about pleasure, but just about living your best life. Right.
And feeling good, and just feeling good within that
Agreed.
You know, can you go to someone and say, hey, yo, man, my thing, this is what's happening. What do you know? You know, the first dude to actually introduce, and I'll say this honestly because I have something available. Okay. Because 10 years ago, about 10 years ago, I met a gentleman. The conversation was supposed to be about government contracting. And that's the premise.
That's how it started.
It was black professionals. It was on one of these websites that's, you know, black professional business owners, you know, network. And he looked at me and said, how your thing working? Huh? Wait a minute. Now it was like, he's just like, I know I'm in Atlanta. You know, it's like, hey, man, you know. But again, I'm cool with if that's your thing. But
I'm not here to judge.
But right now, that ain't finna happen. So we had but then he said, no, we had a sensible conversation. Okay. And I ended that conversation with, I don't feel good about approaching a stranger in the street that I just met, or looking at anybody, current client. Hey, how you doing down there? Or how you performing? I've had probably more women tell me, hey, their husband's this. Do you know anything that they can suggest? But the dudes themselves know.
Understood.
So, I told him, but then I started a practitioner book I was listening to, an audio book I was listening to. She got 2 ears and 1 mouth. Listen more than you talk. And I do talk more than I listen sometimes. So I started listening. Okay. And one dude, a mechanic, said, hey, this is going on. Then I had this problem, then this came up, and then it came out of his mouth. And when it came out of his mouth, I was like, hey, I got this thing. You want to try it? I got some samples, hooked him up, and he's good to go. And now, so that's how it started happening. So people... That's
good to know, though, that there's interest in that, and people are getting
people would ask,
shyness.
Yeah, people would say something to me, and I'm like, as soon as they said something, oh, by the way, this is what I have available for that. But I didn't just bring it to him as I'm coming off of, some pressure and stuff. Yeah. So I've had the conversation. I've had a conversation so much with so many people that even at my past employer, they took it as, oh, you're discussing taboo things with this person. That's unprofessional. No, that person asked me about it. And I said what I knew. First of all, how is it taboo when it's related to our body? Yeah. Well, you're not a specialist trained in that, so you should refer them to someone who is. Yeah, if they trust me with it, then maybe they don't trust the person who is. Because obviously they've been in front of their doctor. They didn't bring it to their doctor. They brought it to me. Right. So I'm going to say something, and again, they had issue with it. Well, it's for them to deal with. And you sort your own self out. Exactly. So that meant I could make these suggestions. And now I do have herbal supplements available in different forms that can help. I mean, there's a side of it that helps mostly men, and then there's a side where you say women can take it too. Again, I just don't. I can't walk up to a woman. Okay, two things. I can't walk up to a woman and successfully have not been able to do these things. Hand them my card when I was just a personal trainer. Okay. Hey, ma'am, here you go. She look at the card. What the hell are you saying to me? Right, some fat. Oh, I'm this, I'm that. No, I'm just saying. Right. I've been coming to this spot for so long. I've been seeing you. I'm just telling you this is who I am. I'm introducing myself. Okay. Another woman at a gas station. She's working there. She works at the place. She's pissed off because somebody messed up the trash. And she's leaning over, getting all this, holding her back and all this. Hey, ma'am, I'm licensed massage therapist. I got a boom spot here in Marriott Square. Come check me out. She ain't come. Right. I saw another woman walking with a boot on, limping, hobbling. Another knee. She's complaining about that knee hurting. Ma'am, I literally told her, your compensation here, here, and here, and doing this, that, and movement bump is causing that pain and this pain and this pain. And when by the time that's healed, this is all going to be jacked up. She ain't come. I believe you. So same thing, so it just goes, no matter what approach I've taken, try to be educational, try to be just, hey, I'm on the run. I saw you doing this. I heard you talking about this. Here's a card. Here's a flyer. That damn word. I don't approach people in the street. Right. So that's okay, because what you're doing is you're building your foundation in 2021. It's going to radiate out, and everybody who needs you will absolutely find their way to right. Yeah, that's what it's coming down to. 100%. Me chiming in on discussion forums, so everyone knows. I'm gonna flip this. I have left these groups: paralysis, stroke, transverse myelitis, MS. Spinal cord injury. I left these groups because me chiming in meant people attacked me, thinking, oh, I'm trying to promote my business. No, I'm giving you information. Right. I shared information. I shared research. I shared testimonies. They took it as me trying to disagree with them. I don't have time for it. You want to be disgruntled about your circumstance, be in your own space with it. Don't bring it to me. So I left those groups. So like she said, you will find your way to me. Right. If you find me, I will help you. 100. If you don't find me and you have the issue, I can't help you if you don't open your mouth. Right. So that's basically what it comes down to. Yeah. If you don't tell me, I'm not gonna chime in. I am not saying I won't volunteer my information if you ask. Right. Because I will bombard you with it. Because at least you'll know they're receptive. What's happening is you're giving it to people who they ain't ready to receive it. They're not. Because what do you do? How long is this going to take me to recover? Well, everyone recovers differently. That's what another person with the same issue said. And I say, well, here's a testimony of someone who did something different than what both of you are dealing with. You are, okay, bye. Right. Understood. Leave group. Sorry, we never had this conversation. Right. Delete my comment. So, yeah. So I left these groups. I don't need tools attacking me because I'm trying to help out or volunteer information from the goodness of my heart. So, and I told the woman, I wear my heart on my therapy heart on my sleeve. So if you have a problem with that, then you deal with your issues. But in the meantime, I'm going to help people who want to ask for help, and I'm going to help them. So, and that's it. I'm leaving those groups. So I'm sorry. If you're listening to this and you have a group, I'm leaving the group. You're like, they should be listening. Yeah, you should be listening because I've left those groups. I do not want to see them in my news feeds on Facebook, Instagram. I don't tweet, so I ain't worried about it. Right. If you don't contact me, if you don't tell me what your issues are, then I'm not going to be the one I can't help you. Right. So if you tell me you want to get down, we're going to get down, so. It is what it is. Get down, family. That's what you want to do. Sure enough. Sure enough.